Hello and welcome everybody. I appreciate the opportunity to talk to everybody about stroke today. Um, Unfortunately, Dr. Chandler was going to be joining us to offer his insights, and unfortunately, he's not going to be able to tonight. So we're going to dig in and just carry on regardless. But we certainly are wishing him the best moving forward. All right, let's talk a little bit about stroke today. So first and foremost, we always want to start with our little disclaimer. So again, this presentation is intended for informational and educational purposes only. And while I am a licensed physician, I'm not your physician, and I am not acting in the capacity as your physician during this presentation. And so we want to make sure that any information that we do provide should not be construed as medical advice, diagnosis, or treatment, and that you should always seek out a physician or other qualified health provider. Again, no doctor-patient relationship is being established during this presentation, and any and all decisions related to medical care should be made in consultation with a licensed medical professional. So, all right. So hopefully we've been doing several of these now, and so hopefully we should have an understanding that Wellspring Healthcare is focused in believing in the power of compassion, effective communication, and empowering lives through education. We believe in delivering personalized care to help you and or your loved ones to receive the best care possible. And that's what we hope these webinars are doing. And this informational sessions are helping you to understand your healthcare better so that you can then take more active control over your healthcare. So certainly, if you would like us to become your physicians, or if you would like us to come into your facility to start working with some of your patients, we would be more than happy to do that. So please keep in touch with us. You can reach out to us a number of different ways. We have some numbers on the screen here. 816-708-1661 is our medical assistant. His name is William, and he'll be more than happy to try and help take your questions and redirect them to the right party. For facilities that may be interested, please contact our Chief Operating Officer, Brandy, and her telephone number is 816-708-1658. And again, we look forward to talking with you. And of course, you can always meet with us on our website, wellspringhealthcare.org, which is, again, where all of our videos are posted. So please don't hesitate to check that out as well. All right, now let's dive into stroke and understanding stroke. So first and foremost, we should understand what a stroke is, because there's multiple different types of stroke. We're going to talk specifically about two different types of stroke during this presentation. But what it really means is that it's a lack of blood flow to a specific region of our brain. So our brain is so incredible and it's so phenomenal, and it has different areas of our brain control different activities. So for instance, if I want to pick up my right hand like this, that is tailored to a portion of my brain on the left side of my brain. Isn't that crazy? So it's my right hand, but being controlled by my left side of my brain. And my left hand is being controlled by a portion on the right side of my brain. And so we have these different areas in our brain that can be controlled by or give information to other parts of our body. And so if a region of brain is not receiving some of that blood flow, then that's when we end up having a stroke. So if I have a blockage in one of the arteries over here, and that's impeding my ability to send signals from my brain down to my hand, I may not feel my hand. I may not be able to control my hand. And the same thing goes for speech and other aspects that we're going to get into a little bit as well too. But let's dig into a little bit more about each one of these different types of strokes. So the first type of stroke is an ischemic stroke. And ischemia is a fancy word that doctors use to simply say a lack of oxygen or a lack of blood flow, because blood carries oxygen. And so if we're not able to get blood to an area, that area is going to suffer ischemia, or it's not going to get enough oxygen, and those cells are going to die. And so this can happen in a number of different ways, but one of the more common ways is through this process of where a blood vessel gets narrowed by plaque. Now, this happens not only in our brain, but it happens in our heart, it happens in our kidneys, it happens in our aorta, it happens everywhere that we have blood vessels. And you can see that this area right here where it's yellow in nature, that area is plaque, it's cholesterol. And plaque doesn't deposit uniformly in a thin layer throughout the artery, and certain areas of the artery can get more plaque, and so it can create this blockage. And then what happens is that some of these platelets in our bloodstream get together, some of this fibrin gets together, and it can clot off a narrow opening. And that's when we're losing blood going to an area of the brain. So I think of this kind of like sometimes a pesky beaver. So a pesky beaver comes into one of the tributaries of a major river, and that beaver builds a dam. And that dam slows the flow of blood. It prohibits the that area of brain getting more oxygen. And so that subsequently then causes a stroke. Now, the second type of stroke that we're going to kind of talk about is a hemorrhagic stroke. And as you can see here in the detailed picture, this is when a blood vessel bursts open, and it can rupture from a number of different things. One of the more common causes of this is a hypertensive crisis or a hypertensive issue, because our blood vessels can get weak, and when they're under a lot of pressure, they just burst open. And when that happens, blood is going to rush out of the artery and in and around the brain, and blood's not going to get to the place that it needs to be as well. So that's another type of stroke. So we have the ischemic, a lack of blood flow because of a lack of oxygen. Blood's been stopped. It can't get through that area. And then you have the hemorrhagic stroke where the blood vessel bursts open. And so blood can't get to where it needs to go because the pathway where it's going is not working correctly. So comparing these two types, again, you have the ischemic stroke, which is a blocked blood vessel, and then the hemorrhagic stroke, which is a ruptured blood vessel. So blood is escaping out of the blood vessel in the hemorrhagic stroke. And this can lead to a whole other host of problems as well, too, because it can lead to a compression of the brain, and that can be another significant problem. The ischemic stroke can also lead to compression of the brain, but usually due to swelling. So as an area of the brain loses oxygen, those cells are going to die, and those cells burst open, and that increases swelling, and this brain can swell as well. So both of these can lead to a lot of similar things, and a lot of their features can look the same, and it's impossible really to tell whether you're having an ischemic stroke versus a hemorrhagic stroke when you're just looking at someone, but we can know that they're having a stroke. And so that's going to get us into our stroke symptoms. So our stroke symptoms, we have this little mnemonic here that we like called be fast. And this is how we can get some warning signs. So if we're having some difficulty with our balance, we're feeling a little bit off kilter, our eyes are maybe moving in an abnormal way. As I look to my right, they're moving to the left. That can sometimes be an indication that something's going on. If one side of our face is asymmetrical, if I go to smile, when I smile, hopefully you're seeing my lips move up symmetrically. The same on the right as the left. But sometimes when we're having a stroke, this one side of the face moves up, but the other side stays where it is. And that could be another sign too. Or if we have one arm versus the other arm having weakness, or the same thing with a leg. So an arm stands for A. And so we've got to get that understanding that if our arms or legs, on either side of our body aren't working, then that could be a sign of a stroke. If we can't talk, we can't form the words, or if we're speaking gibberish, these are things, or if we can't understand words that are being said to us, these are things that are very concerning. And so the T stands for time to call 911. So very important to be able to identify these stroke symptoms, and putting this together in a mnemonic makes it easy for us to recall. So be fast, balance, eyes, face, arms, speech, time to call 911. So keep that in mind so that we can get you treatment as soon as possible. And getting treatment as soon as possible is extremely important, because if we have one of these ischemic strokes where there's a blockage, we have some medicines that can potentially help to break open that blockage. And those only work, though, if we can get to you in a short time frame, typically no more than 4 hours. There are some certain circumstances where we can go longer than that, but the general rule of thumb is that we want to intervene in a very short period of time, because it lowers the risks associated with this medicine. And so getting to the hospital quickly, being able to identify that you're having a stroke, and then getting this medicine right away is very important. Same thing is true if you're having a hemorrhagic stroke. That's not to say that if you're having a hemorrhagic stroke that you should take your time to get to the hospital. You should not. The sooner you can get there, the sooner we can diagnose it, determine the extent of it, and monitor you closely to see if we need to take you to surgery or have another type of intervention. So it's very, very important. And so if you're the person that's responding to somebody that's having a stroke, they might not be able to call on their own. So it's going to be very important for you to be able to call 911. We don't want to give them anything to eat or drink or do any of that nature. We want to just instead try and keep them calm. We want to keep them as comfortable as possible. We want to reassure them that help is on the way and that they are going to get taken care of. All right. So now we've talked about 2 different types of strokes. We have talked about the signs and symptoms to look for when someone has a stroke. And then we've talked about what to do, which is to call 911 and seek medical attention right away. But there are some things that we can do to try and prevent strokes from happening in the first place. So what are some of those things? So we have a few things. The first thing is, we talked about ischemic strokes, is that cholesterol can be a cause for creating these quote unquote dams or narrowing of our arteries. So if we eat healthy, or eat healthy foods, that's going to dramatically help to lower our cholesterol. So if we're eating McDonald's for 2 to 3 meals, twice, 2 or 3 meals a day or 3 times a week or something of that nature, that tells us that that's not probably the healthiest thing that we could do, or any other fast food for that matter. It doesn't have to just be McDonald's. I don't mean to pick on them. But if we're having fast food on a regular basis, that's a dietary modification that we should really be making. If we're instead eating nothing but broccoli, although healthy, we're probably going to lack on some nutritional aspects as well too. So we're going to need to have a balanced diet. I want you to have good protein. I want you to have lean protein. I want you to eat vegetables like broccoli. I want you to eat vegetables like Brussels sprouts. I want you to eat vegetables like lettuce and kale and tomatoes and things of that nature are going to be good, healthy foods. And I want you to focus on eating whole foods. So foods that are harvested from the ground, from the earth. They're not pre-processed or they're not pre-packaged. A lot of the time, a good rule of thumb is that if you spend a lot of time in the grocery store, walking up and down the aisles in the center of the grocery store, you're likely going to be consuming less healthy food than if you stick to the perimeter of the grocery store. Because in the perimeter of the grocery store, you have the produce section, you have the dairy section, you have the meat counter. So you're going to have those types of options usually on the perimeters of the grocery store. So that's one of the things that we can do for diet, is eating. And then we're going to get into lifestyle. So by increasing our physical activity, this can do a number of things for us. It can help to lower our blood pressure. It can help to increase our compliance of our blood vessels. If we stop smoking, this is another factor that can really help, because smoke, particularly cigarette smoke, can lead to a hyperinflammatory state inside of the artery, and that can exacerbate or worsen these blockages that occur. Limiting alcohol or stopping altogether. This helps to make sure that our blood's not getting too thin, or that our blood vessels are getting weak. We also want to make sure that you are seeing your primary care doctor on a regular basis. Very important, because your primary care doctor is going to be able to help diagnose you with high blood pressure. They're going to help to diagnose you With your cholesterol issues, they're going to be able to prescribe preventative medications. They're going to be able to talk to you about your healthy eating. They're going to talk to you about your physical activity. They're going to help you with weight management. They're going to help you if you have tobacco issues. So, a primary care doctor cannot be understated in this type of situation. Diabetes is another factor that's very important to address because there's not too many things that can damage blood vessels as quickly as diabetes. So diabetes is creates an inflammatory state in the blood vessel that can worsen the cholesterol and plaque development that can occur. So very important to manage these types of primary um, medical problems that can lead to stroke so that we can try and prevent a stroke from happening in the first place. Or if you have had a stroke, it's even more important for you to go through these lifestyle modifications in order to try and minimize the chances of a future stroke. So, in summary, strokes are serious, but we can certainly recognize the signs and take actions to reduce our risk. Small steps can certainly make a big difference in your health. So, we want to make sure that we're following up with that primary care doctor, that we're doing everything possible in order to optimize our health as a general rule of thumb. All right. So I hope that you enjoyed that talk on stroke, and hopefully it helped you to get a little bit better understanding about what causes a stroke, what signs and symptoms to look for in stroke, because we've got that be fast mnemonic. So balance, eyes, um, face, arm, speech, time to call 911. So don't forget that mnemonic. It's very important. And then we want to also make sure that we invite you to our next monthly webinar, which is going to be the healthy lifestyle changes for the new year. So if you're struggling to work on some of these lifestyle modifications, this will be a wonderful webinar for you to attend so that you can kind of dip in your toe into understanding some of the different aspects of lifestyle changes and how we can make and what we can do and how we can make them so that they don't seem overwhelming, so that we make them so that they seem like they are achievable for a year-long process. So we look forward to you joining us for that. Of course, don't forget to keep in touch with us. Please reach out to our medical assistant, William, or other facilities. Please reach out to our chief operating officer, Brandy, as well. And of course, always visit us at our website, Wellspring Healthcare. So we look forward to seeing you there. So I'm not seeing any activities or any active chats going on right now. Let's double check that and make sure. Yep, we look good there. So again, I greatly appreciate the time that you've taken to participate in this webinar, and I hope you learned something. We look forward to seeing you soon. Thanks so much.